Hello, welcome to IVCC Summer Sessions 2020. I am your teacher, Mr. Fogle, instructor of CPR, First Aid, and AED utilization by the American Red Cross. So the goal here, our purpose, is to give you the knowledge, the experience at home to be able to access the fundamentals to how to care for different injuries. Basic injuries to maybe even more intense situations where we're going to need more help. So we know to call 911, we know to activate things, and we are that key link. So our goal here is to become very, very well adept at all this information so we can be very successful in saving lives, because we have to think that life could be somebody else's special someone, right? Would you want them to help if they were certified to help your loved one? Absolutely, I hope so. That's why we need to be able to know when to act and know how to approach people and show a little kindness and compassion here, right? Good stuff. So introduction to course, okay? Stuff that we have to do. I'm gonna put Bob, our little dummy, down. We're gonna be going to this dummy a lot when it comes to checking, looking for the signs of life. But we're gonna be using things like lecture notes. So I'm gonna talk about all the notes that I have from my experiences here at IVCC. Great co-teacher Tony Ruda, he has a lot of information that he's provided with me too, so I get to access that and give that to you too. I'm going to do all videos though for you here. I'm going to sometimes pull some things up from the internet that's already done by the American Red Cross to cover some bases that I can't necessarily show you, right? Videos that they want me to show you. So it's going to be very important. We're going to do little discussions. Hopefully that's going to be via thread. So you see this video, sign into YouTube. Leave a comment, please. I need you to leave comments. I love comments. I love to hear what you know already, situations that you've been through, how you reacted, how things could have worked out better or differently, or vice versa, or how you really took the correct course of action. Just give it all, you know, make it go into different tangents. I don't mind. It's just good to get that aspect of learning different ways of life, how things happen, you know, by chance, so to speak. Readings, that's going to be extremely important for all of you. I really, really need you to take some time and actually read some of those pages in this book that we have provided for you with the Participations Manual. Participants Manual is available at IVCC Bookstore. You can walk in there, you know, mask up, do what you got to do. But you can also order these online a lot of times, and sometimes they could be cheaper, so do look around. The main thing is that it's the most up-to-date Participations Manual. 2016 or newer would be best. Group activities, like I said, that's going to be the videos. And skill practice, hopefully we get to that point. I'm going to show you those skills on camera, break those down, the components of them. There's going to be some videos, like I said, outside that are going to show you what you do too. But then I want you to practice at home with pillows. You got to use your imagination a little bit right now. I'm going to try to come up with some ideas. I think, honestly, like something like a football or a basketball has the right kind of pressure to use, so you can push on that to get that at-home feeling. Obviously, don't use a real person to push on their chest. That's only when we are having a cardiac emergency or no breathing, no circulation. Other things to do then too, like I said, check out that book. It's going to have everything you want to know for the basics in hard print. So it's your go-to manual. Every test question comes directly from those notes there in the book. So if you read through the book, if you have good common sense, you pay attention to what I tell you here, it should be really easy for you to pass every single test with flying colors, get your A, get your certificate. If you have any other questions, of course, email me, fog0845@yahoo.com. 80% or higher, remember, we got to get that. I told you that time in class. And then other things to go into here. Goals, right? How good do you want to be at this? Now listen up. I'm going to turn this around so you can see it. This is a good video.
The saddest experience one could have would be to have a friend or a family member, someone that you love, need CPR and you not be able to give it.
Put yourself in that person's shoes and realize, okay, well, if this were myself or this was a loved one, what would I do?
Well, whenever I'm talking with other moms, I just always urge them to get that training, seek that out, because you never know when you could save your child's life.
CPR, like any other medical procedure, is not 100% successful. However, what it does always do is give someone a chance. And I really think it's important to get that chance.
Mm-hmm.
My feeling was that I had saved someone's life. I had allowed myself to step out of myself.
In that moment, it was very calm and very, just very matter of fact. You just rely back on that training, and it just kicks in, and you know what to do. After it's over, then there's this overwhelming sense of panic. Oh my gosh, what just happened? And then there's a sense of relief because you just don't even want to think about what could have happened if you didn't know what to do.
My name is David Pellman.
My name is Diane Carter.
I am Rose Talbot.
Dramatic, right? A little, but real. I mean, these are real life experiences, and you could very well have one of these yourself one day, where you get the chance to save a life, and just by knowing how to act, when to act appropriately in the situation, could be all the difference. I had some friends do this for me, actually, so I want to make sure that I really get this message across with you here. And stay tuned for that story. Okay, that's about halfway through. Introductions otherwise, okay, we can look upon scenes. We want to make sure we're making action, but we want to make sure we're stopping and looking at the situation, really making a good analyzation of it, and then moving and managing what's going on, because we might be the most well-trained person in that situation since we are now getting certified. So if you see a car accident, right, you can see debris, you can see airbags deploy, you can see people conscious, unconscious, right? Depends on the situation, depends on the nature of the possible catastrophe. There could be dangerous hazards around then too, like leaking fuels, electrical things, fires, you name it. So you gotta think about your safety first. Is it safe for me to act? And then move into that situation. Secondarily, right, if it is safe, which hopefully so, how can we help that person the most? So many types of injuries, right? We have damage to the body from an external force. We have sudden illnesses, right? There could be diabetic emergencies, heart attacks, strokes, all sorts of things with even everyday people. With heat-related illnesses, cold-related illnesses. We have life-threatening versus non-life-threatening too. So life-threatening would be, oh no, we must call 911 first because this person is not circulating oxygen, meaning their heart's not pumping blood that is oxygenated from the lungs. Right? We have to perform CPR. Hopefully we've called 911 already, got that going on. Non-life-threatening, right? We analyze what's going on and try to pick the correct course of action for what symptoms we're seeing, any allergies, medications the person's on. That way we can decide who to call or how to manage the situation to prevent it from being like something where we have to use hospitalization or calling 911. We want to try to limit, right, the amount of minors becoming majors, pretending to be majors. We want to keep, right, less bills down, simple things. Anyway, we'll get to that later. The main thing is what I'm saying is EMS. We want to make sure EMS is not overwhelmed by things that are not important, that they're there active for things that are heat of the moment, heart attacks for real, right? A baby getting birthed and we can't rush her to the hospital. We need them to come here. Just little things like that. And we are the link. We are the link to make that whole chain happen in the first place. Emergencies exist, right? We need to recognize. So pretty easy most of the time. We can recognize if an emergency exists. Somebody just drops right down on the floor, right? Stroke, heart attack, a seizure. You never know what's going on. We need to recognize the emergency and depend on the nature of it, whether or not to call 911 or not. But the worst thing we could ever do is not act at all. So we need to make contact with that individual. We need to talk to them. We need to communicate. Hopefully so, when we see the threatening ones, we call 911 as soon as possible or have somebody do it for us while we're managing. Your role right, is to look for these things first and foremost. Indicators for emergencies would be unusual noises. This could be sights or sounds. Like I said, odors. Very much so odors, and then just unusual appearances or even behaviors of an individual. So again, 911, not a hard number to know. Call that one. That's the best one to have. What would you do? This is pretty funny.
Somebody's not happy with lunch.
Yeah, he should have gone to the show shack.
Get that email from Natalie.
What about the cats?
What was that?
Do you think he needs help?
You know, no. It's probably nothing.
I don't know, Steve. He might have a serious medical problem.
Nina, it's not our problem.
I'm going to check it out.
Come on, Nina, don't.
Sir,
I hope you know what you're doing. You might get sued. You realize that?
is everything okay here? Something's wrong with this man. I'll get a first aid kit and call security. Security?
That guy must be drunk.
I'm Nina. I have training in first aid. Is it okay if I help you?
Consent. Recognize consent.
Can you tell me what happened?
Glove up.
Can you tell me your name?
Asking
Sir?
good questions. Gentle.
He has diabetes. We need to get him help right away.
Can you tell me what happened here?
He suddenly fell over. His medical ID says that he has diabetes. I think he needs help.
Okay, I'll call 911. Security officer 132.
Very good, right? Very good course of action. Good scenario. The girl who was trained, right? She observed things that some everyday people might not. So she was able to act accordingly, identify the wristband that the gentleman was wearing, asked for consent first off, see for help. A nod, a gesture of any kind works for that. Of course, with children, we'll get into that later. But we don't want to hesitate. There could be barriers, but we don't want to hesitate. That's why, right, we gloved up, we mask up, we do our little things. We have a breathing barrier if we ever have to perform CPR, right? That means that it's going to be this plastic shield, right, which is going to create a barrier between you and that person's mouth, so that way you can actually blow air into their lungs. It's very important to be able to supply that, right? So we have to make contact unless you have carry around a whole apparatus. So who does that? This little piece of slip, you keep it in your wallet, keep it in your purse at all times. You use it one time, right? And then you get a new one, cheap. So that's one thing that is super important for your first aid kit. That is the number one item. The number two item, your rubber gloves. Any non-latex is best because of allergies. So right here, any blue, white, pink, purple, whatever color you prefer, just have a pair. I'd really say have like 3 or 4 pairs though, because they sometimes rip easily, especially if you go out to several victims, right? You don't want to cross-contaminate. Sometimes you might have somebody there to help you, so you can use the several pairs. I'd like to say have a whole box. Get a box if you can. Keep some of them in your car, keep some of them underneath your kitchen sink, keep some in your laundry basket, whatever. I mean, not laundry basket, laundry room, whatever it is, wherever you keep your supplies. See other things then too. You might be scared, right? I could be very scared in the heat of the moment, I'm sure too. I had experience where my fiance, she got into a bad accident where she fell off her skateboard and smacked her head and broke her wrists. So I was kind of freaking out because I didn't see it happen, but I came upon it. At first you go, okay, I need to calm myself down and see if they're okay. Great thing is, in my situation, she sat up, seemed okay, so awesome, but still scary. Scary, because this is a loved one. Try not to panic, try to breathe, and just understand that call 911. That's the quick fix. They'll come and help when it's that catastrophic. The worst thing is to always do nothing. Other things then too about helping strangers, right? It's weird, especially with COVID stuff or whatever it may be going on. Right? Talk to people. You can always talk to people. Nothing's going to hurt from talking from a short distance away. The main thing is that you've approached them safely. You've identified who you are, right? I'm trained in first aid. I'm an American Red Cross certified instructor, or not I'm an instructor, but certified, representative, meaning that, hey, I'm certified in training for first aid. May I help you? That's a perfect way of saying that. Introduce your name. That's always important. Let them know who you are so you're not holding back. Hi, I'm Kyle. I'm certified by the American Red Cross in first aid. I see something's going on here. May I help? Let me know what's going on. Asking questions. Open-ended questions. Ask them about the basic things like what you've seen. Do they have any allergies or symptoms going on with whatever's going on? We'll get into that later. I'm sorry. But take action. That's the main thing is what I'm getting to. You have fear of disease, right? No. Gloves, breathing barrier. No fear at all. Other things then too, fear of being sued, that's gone. We have the Good Samaritan law in place, so you not acting is actually worse. You should at least introduce yourself and try to confirm what's going on, see if you can help. If they say no, then your hands are clean. You walk away, you go do your thing. Other things then too, 911 can sometimes help you walk through whatever scenario is then as well, but sometimes it might be better to actually call the Poison Control Center in the first place. That can save 80% of the calls and call time that 911 is receiving often. Much more efficient way of letting them handle more serious situations that maybe you can handle over the phone real quick. Sometimes even calling the medical doctor that they have is a quick fix if they are available. Again, other things then too, these are the 5 reasons why we always give care until. 5. This test question, so write this one down. Give care until you are giving CPR and you see obvious signs of life, such as breathing. 2. Another trained responder or EMS personnel takes over. 3. You are too exhausted to continue. 4. The scene becomes unsafe. And 5. A conscious, competent person you are helping asks you to stop. So they say, oh no, stop. I don't need help. Okay. Now, obviously, scene becomes unsafe. We're trying to move people out of that situation, then continuing care. Backtracking again, too exhausted to continue. You take your breather and you get back to it as soon as you can. It's very important to help circulate blood. We can stop for a couple seconds to catch our breath, but we need that person to keep circulating blood because they're unconscious, right? Other things, right? Another trained responder, so you have a partner or somebody you can tell what to do and you can show them what to do exactly in the heat of the moment so you can take care of other things. Takes over so you can get that breather. EMS, lifeguard, let them take over. They're better than us. That's what they're trained to do. Remember, we have a scope of practice. We don't want to go past it. Acute stress may be a response from you. So like you might freak out, like I said, panic. Main thing to do is breathe in the heat of the moment. Now there could be a stress response post-event, like maybe you could have done more, you're thinking, because the person passed away. Well, again, like the video said, like you have to understand that you're doing the best care possible. And if somebody passes away, you tried your hardest. You tried to help sustain their life. You've made an impact, so to speak. So there shouldn't be guilt, but you should be able to go and talk to people. So come to me, right? Or come to somebody else in your circle of who you know with this now. You can go down to the branch in Bloomington, Peoria, and they can go ahead and talk you through a lot of this stuff, which is nice. They know a lot more than me. Signals, okay? Depression. You might have that. You might have anger, upsetness. The main thing is try to seek some help. Talk to people, talk to friends first. Moving on to taking action, let me tell you one scenario. A motorcycle with 2 riders weaves dangerously between parked cars in a crowded parking center parking lot. As the motorcyclists dart between cars, they confront a moving car. Both the car and the motorcycle veer to avoid a head-on collision, and the motorcycle strikes the side of the oncoming car, throwing the riders to the ground. The car stops abruptly, throwing the driver into the windshield. So, sounds like it wasn't wearing a safety belt, maybe. Nearby, Jamie and Paul, 2 college students, hear the sound of the crunching metal and blaring horns and decide to join the small group that has gathered. Okay? Now let's continue. As they approach this scene, Jamie and Paul are confronted with the sight of broken glass, strewn metal, and a cracked windshield. A gas cap lies nearby, and they notice that what appears to be gasoline that's spilled from the motorcycle tank onto the roadway. One person is screaming in pain as she sits holding her arm. Okay? The other person lies motionless, not moving at all, right? 2 people wearing safety belts are inside another stopped car. Okay? The driver appears to be shaken. Now, several onlookers turn away, apparently unable to cope with what they see. Other bystanders continue to gather. As Jamie and Paul look around, no one seems to be helping. They hesitate, wondering what they should do to be forward and helping. Okay? This is what you do. This is what we always go to. This is our bread and butter gold standard right here. CCC, triple C, okay? Check, call, care. Check, call, care. I'm going to drill this into your brain over and over. Check the scene for safety. Check the person for life-threatening conditions. Call 911 or local emergency number, and then care for those injuries found for the person. Okay? Check the scene. Check for safety. Check the person. Call 911. Care for the person. Check, call, care. Check, call, care. Go back to this for every single question. Every time they ask you on a test, you follow this first. It's going to lead you right to the promised land. All right. So let's apply it. Okay. Is the scene safe? The scene that we read, was it safe? It sounded pretty safe. Okay. Everything had stopped so far except for that gasoline. How close is the gasoline to the people? That's what we're thinking. We probably want to try to move people if their gasoline is moving. But if all engines are off, everything around the vicinity is off, no flame, the gasoline fluid is not that combustible. Like vapor is, but that means it needs ignition. So if we are 30 feet away, that should be plenty. Hopefully we're more if so. But 30 feet, if we're any closer, if we have fear of that, we might have to move those people further. We have to think about how safely we can move these people now too, which we'll get to in a little bit. Okay. Is there immediate danger? Engines all off, that helps out a ton. What happened? We can talk to the bystanders, the people in that car that were a little shaken up with their seatbelts on, and ask them, hey, what did you see just happen right now? They could tell you. You can obviously see the people involved. The one car with the windshield cracked from the guy hitting it, and then or what could have been the motorcycle that hit it. We don't know yet. But the motorcycle definitely hit the side of the car, right? The girl's screaming. Life-threatening? Maybe. Probably not, though, because she's screaming. She's alive. She's sitting up. Okay? Sitting up's a good thing. Compared to some other things like being completely unconscious like the other person. Now we're looking head, neck, or spinal cord injury. Much more life-threatening overall in the first place of what we see. So ask bystanders to help you. You move into that heat of the moment. Now this is what Jamie does, right? She instructs everybody to stop traffic, turn off engines to the cars, apply parking brakes, okay? The leaking gas from the motorcycle is not close, so they don't have to worry about the drivers or the passengers. Jamie checks the motorcycle driver and determines that he's unconscious and instructs someone to call 911, and then she then continues to check the person to determine if he is breathing. So we'll go through ABCs later. Another one, ABCs, airway, breathing, circulation. We're going to cover those real hardcore all the time too. So check, call, care, airway, breathing, circulation. Those 6 steps in a row. Paul's checking on the two people that are conscious and asking them questions. The girl is still screaming and being attended by another rescuer that's on her arm, but controlling the bleeding, which is awesome. So control bleeding. So we figured it out. Everybody seemed to game plan really well there. The left people were bystanders, so we were able to analyze the situation. The main thing is that you're not having to do this in 10 seconds. Breathe. Look at the situation. 1 minute of time frame is long, okay? But we need to determine what needs to be acted on first. So we see that unconscious person. We got to beeline there. We got to call 911, beeline to that person, tap them. Are you okay? Unconscious? Open up the airway, check for breathing, check for circulation. This is pivotal. Okay, then we can start to analyze everything else even more. Other things then too. General rules for calling. Let's just cover those. Unconscious person, we call. Altered level of consciousness, we call. Breathing problems, we call. Chest pain. Persistent abdominal pressure or pain. Severe bleeding, external or internal bleeding wise. Vomiting and passing bloody stools, things like that. Critical burns. Suspected poisonings, and sometimes seizures too. Other things then too, strokes obviously, injuries to the head, neck, and spinal cord obviously, anything where we don't want to move the person, open fractures where we see other body parts sticking out, bones sticking out, right? We get a little graphic here, I'm sorry. Go ahead and watch an episode of Walking Dead and they'll make this class child's play, hopefully so for you. Anyway, fire and explosions, right? We want to call because these are hazards to other people then as well, or environments. Electrical wires down, tornadoes, catastrophic things, motor vehicle collisions, right? It's good to call. So when to call or when to care first? Another pivotal test question. If you are alone, you must decide whether to call first or care first. Your call first situation is number 1, an unconscious adult or adolescent ages 12 or up. Number 2, a witnessed sudden collapse of a child ages 1 to 12, right, or younger. You witnessed them collapse. 3, an unconscious child or infant that has a known cardiac condition. Dropping just out of nowhere, we're thinking cardiac condition. Adults, cardiac condition. Okay? Situations that are cardiac emergencies, pumping blood. Care first situations. We care first if there is an unconscious person younger than 12 who you did not see collapse. So right, maybe the monkey bars. The kid was playing, fell off the monkey bars, landed on the back, got the wind knocked out of him, stopped breathing altogether. You give them a couple of breaths, 2 breaths, and all of a sudden they start breathing, no problem. Their lungs fill up. The heart was probably beating still. We can always check, though, airway, breathing, circulation. We'll learn that with children, we usually give 2 rescue breaths immediately after checking for circulation, and then go into our CPR. Breathing emergencies, right? Breathing. Think of it that way. Breathing versus cardiac. We call for cardiac. We care for breathing. Drowning, right? You don't say, oh, see you later, guy. I'll let you drown, like on the Sandlot, right? That little kid drowning, even though it's a funny situation. But if somebody was drowning, right, we need to do some kind of way of helping them. If they're unconscious drowning, if they're dragged ashore, right, we're going to need to understand that's a breathing emergency. We're going to have to go ahead and give those breathing and a combination of compressions and rescue breaths. Again, we'll get to that later. And then care, right? Life-threatening conditions are always first primary. We don't want to do any further harm, so we don't want to move body parts unless we tell them we're going to do it, or help them do it, or let them do it themselves, or if you feel like it might worsen the situation. We have to make sure the person is not overheated or over-chilled. When somebody's going through a state of shock, they can feel extremely cold out of nowhere, or extremely the opposite way, but most likely really cold, so we have to make sure we keep their thermal temperature up to the correct place. We have to reassure them they're going to be okay, give them that sign of hope, right? And be confident, right? Be confident in the skills that you're learning in this class. Things to never do. We never want to transport somebody that could aggravate their injury. We never want to do anything that's going to develop into a life-threatening condition if we move the person. So, right, if the lady's pregnant and she's giving birth and it's like coming out right now as we speak, we don't want to be in that car while she's trying to actually expel the baby. We'd rather be sitting there waiting for 911 to arrive and have the baby there, and they can do that. Other things then too, so I think that's great. I think we can stop there. Make sure you read before giving care. This is the first test, so make sure you read this information. It is a 20-question test. That means you got to get 16 out of 20 to pass and continue on. I'll provide that for you later on, but we're going to go notes for the first week or two. And thank you for sticking with me. I'll try to change my scenery every once in a while, give you a new backdrop, but you don't have to watch unless I'm playing a video. That's a good time to watch. You can also just, I'm sure you can listen to it in some way or some shape. I don't know how YouTube works anymore. I'm just getting into this. So thank you. Thank you for sticking with me, and see you next time.